Warning, is your Medicare Advantage plan terminating in 2025? If you've not paid attention of Medicare Advantage news lately, then you've probably not heard about numerous headwinds facing Medicare Advantage plans, from increased utilization of benefits to more government control over prior authorizations and benefit denials to less funding from the government and from numerous hospital and provider groups dropping out of Medicare Advantage networks. Most of the big Medicare Advantage insurance companies like UnitedHealthcare, Humana, Aetna, and others are planning on either terminating existing plans, crosswalking them to another plan, and or exiting certain markets or jurisdictions altogether. So if you have a Medicare Advantage plan right now and are considering getting one soon, then please pay attention to this video, because I'm going to let you know which Medicare Advantage plan companies are planning on terminating plans that I'm aware of so far. And then I'm going to tell you why this could be very good news for you. Plus, I'm going to include an important health tip at the end. Hi, I'm Chris Prang, the Medicare analyst. I'm a licensed agent in 14 states, and I am based out of Charlottesville, Virginia. Maximizing your Medicare should be important to you. My goal is to help people like you make a wise and confident decision about all of your Medicare choices so that you can protect your income, your assets, your savings, and your health. If today is your birthday, then a very happy birthday to you. Kristen Young said, "I love the big fresh starts, the clean slates like birthdays and New Year's, but I also really like the idea that we can get up every morning and start over." As I record this video, you are less than 2 months away from the Medicare annual election period starting. And given everything that is going on that I mentioned earlier, there is expected to be a considerable amount of shakeup for the 2025 Medicare Advantage plans and the Part D drug plans. Some of the companies are even anticipating that their membership will decline in 2025. This is practically unheard of given the huge growth of Medicare Advantage over the last 10 years. Let's start with Humana. Humana expects to lose, quote, a few hundred thousand, unquote, Medicare Advantage members next year. On an April 24th call with investors, Humana executives said it will look to pull back benefits and exit some markets as CMS continues phasing in risk adjustment changes. Quote, "We expect benefit levels, plan stability, and choice for seniors to be negatively impacted by the final Medicare Advantage rate notice, which is not sufficient to address the current medical cost, trend, environment, and regulatory changes," unquote, CEO Bruce Broussard said. CFO Susan Diamond said the company will expect to see membership decline as it exits markets. Quote, "We are anticipating net membership declines in 2025, largely because we do plan to exit certain plans and counties," unquote. Ms. Diamond said, quote, "Whether that is incrementally larger or smaller based on the other plans will be very dependent on what we see across the competitive landscape," unquote. Aetna-CVS health executives are bracing to lose up to 10% of Aetna's Medicare Advantage members next year. Bloomberg reported on May 14th. According to the Wall Street Journal, Aetna offered more supplemental benefits than its competitors in 2024, one contributing factor to its growth. Now the company will likely cut back on some of those extras. Mr. Cowhay, Aetna's CFO, told investors Aetna may reduce supplemental benefits such as fitness memberships, over-the-counter allowances, and transportation assistance for its 2025 offerings, according to Bloomberg. Centene-Wellcare. I recently received an email from Centene regarding their 2025 market realignment. Here's what they said. Quote, "Based on this year's review, we have decided to discontinue offering Medicare Advantage products in 6 states beginning with the 2025 annual enrollment period. We will be exiting Alabama, Massachusetts, New Hampshire, New Mexico, Rhode Island, and Vermont. Wellcare will continue to offer prescription drug plans in these states, and this decision does not impact our marketplace or Medicaid contracts in these markets," unquote. Cigna is selling its Medicare business to Healthcare Service Corporation. In an email I received from them, they stated, quote, "Since the transaction is expected to close in 2025, there will be no changes to Medicare Advantage plan benefits or premiums in plan year 2025 for either company. Medicare supplement plans will follow state filings. HCSC and Cigna members will remain enrolled in and covered by their existing HCSC or Cigna plan upon the close of the transaction in 2025 for the duration of the 2025 plan year. Other carriers exiting markets are Blue Cross Blue Shield in Arizona and Kansas City, Clear Spring Health in South Carolina and Virginia, United Healthcare. As of now, I have not heard anything about United Healthcare's plans on exiting markets or terminating plans. So what should you do? In September to early October, be on the lookout for either your annual notice of change. If you get one of these and you still have a plan for next year, it's possible the company will do what is called a crosswalk of your plan to another like plan. Or look for a termination of plan notice. This notice will tell you that your plan is terminating at the end of the year. It will tell you what your rights are for getting a Medicare supplement guaranteed and how much time you have to make any change. If you ignore the letter and do not make any change, then in January you will be on original Medicare and have no prescription coverage if your current plan had prescription coverage. If your plan is terminated, this means you now have a guaranteed right to purchase a Medicare supplement policy regardless of past or present health conditions. This could be very beneficial to some of you who have wanted to get a Medicare supplement but didn't medically qualify. The letter will tell you this and you need to hold on to that letter. If you want to stick with Medicare Advantage, I would think there will still be some decent options for you to pick from in most states. If you live in one of the states that I'm licensed in and you want my help either getting a Medicare supplement or new Medicare Advantage plan, please reach out to me starting in late September to early October. If you have any questions about what I've just gone over and when you're ready for my help in maximizing your healthcare and retirement insurance coverage and making a wise choice when it comes to all of your Medicare insurance options, and you live in one of the states that I'm licensed in, which you can see here, then please feel free to reach out to me either by phone or through one of my contact forms on my website. We will have an open and honest conversation about your healthcare needs and philosophies and budget. I'll do my best to answer any questions or concerns you have. Once we determine what is best for your unique needs and budget, I will then enroll you in the plan or plans of your choice and, of course, be available down the road for your support. To stay up to date and to gain more insight on maximizing your Medicare insurance, then please go ahead and subscribe. And who do you know who may benefit from this info? Please share it with them. One last thing. It is well established that resistance training offers many important health benefits, including improved health, reduced risk factors for developing a chronic disease, and an improved ability to perform activities of daily life. The U.S. Department of Health and Human Services includes the following recommendation. Quote, adults should also do muscle strengthening activities of moderate or greater intensity and that involve all major muscle groups on 2 or more days a week, as these activities provide additional health benefits. As part of their weekly physical activity, older adults should do multi-component physical activity that includes balance training as well as aerobic and muscle strengthening activities, unquote. According to the data, older adults who performed strength training at least 2 times per week had 46% lower odds of dying for any reason compared to those who did not participate in strength training. Furthermore, adults in the survey who performed regular strength training had a 41% lower odds of cardiac death and almost 20% lower risk of dying from cancer. Additionally, those who participated in strength training were more likely to have a normal body weight, engage in aerobic exercise, and abstain from alcohol and tobacco. Clearly, if you're looking for a way to improve your health, enhance your quality of life, and increase your overall lifespan, you should consider adding more resistance training to your current level of physical activity. I hope that encourages you and challenges you. I'm Chris Prang, the Medicare analyst. Make it a great day.